So let's go through these and talk about what you were able to treat and accomplish and what process was used.
So remember, lots of times that these patients are a combination of treatments. So whenever I approach a patient, I always try to approach the patient from a medical perspective. And I try to treat the underlying problem first. Remember in the beginning of the broadcast, I talked about venous hypertension. Well, often in these patients, what I do is I treat them with one of these two procedures, either the venous seal or the RFA catheter, and then we come back and we treat them for a more aesthetic result. In this case, you can see that varicose vein by her ankle, and you can see that has physically been removed using stab phlebectomies. So essentially, this is another very minimally invasive procedure done in the office under local anesthesia, and the patient has had quite good cosmetic results as a
Now, will she have to come back?
I typically, after these procedures, I bring them back in 6 months to reevaluate the venous system and make sure that the veins are stay closed. In addition, I continue to follow them and also advocate good vein health. Lifestyle changes and using the stockings if need be.
All right, let's see our second example. What are we looking at
here, Doc? This is a cosmetic procedure where foam sclerotherapy had been injected into this cluster of varicose veins, and here you can see
it's lightened.
Yes, the vein is gone. And here it's actually interesting because you can actually see, if you look at the around the 5 o'clock position, you can see kind of a dark greenish vein that's actually leading. It's almost like a road leading into that cluster of veins. And remember, I told you about how there's a venous hypertension in the deeper veins, and there might be just an iceberg. This is almost on a miniature scale.
Of an iceberg, yes.
Exactly. You can see the deep vein, the little deep vein down there, feeding that superficial cluster. By closing that cluster, I'm able, that deep vein, I'm able to close that cluster.
Wow, this is incredible.
This is more of a cosmetic procedure where we just injected medication, pilodocanol, into these sclerottant medication to cause essentially sclerotherapy and remove these veins for a more aesthetic appearing leg.